Can bleeding happen in early pregnancy? Is it normal or abnormal? What to do in such cases? Let us discuss all about bleeding in early pregnancy. Hi, this is Dr. Abinaya Vijayakumar. I am a doctor and a post-pregnancy coach. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay happy and confident throughout their pregnancy and to connect with the child using Garbh sanskar techniques. To know more about the courses, DM me on Instagram or reach out through email. I'll provide the links in the description. Do check it out. So with no further delay, let's get started. Bleeding in early pregnancy can be alarming to every pregnant woman. This one challenge can keep them awake at night, making them sleepless, worried, stressed, depressed, and whatnot. But not all the time bleeding could be hazardous. There could be physiological bleeding or there could be pathological bleeding. Let us discuss more about this. First and foremost, when is bleeding in early pregnancy considered normal? In the early weeks of pregnancy, the fertilized ovum gets buried itself into the wall of the uterus, thereby enhancing the blood supply to the growing fetus. So when this gets buried into the layers of uterus, that creates a raw area on the wall of the uterus which can be a source of bleeding early weeks of pregnancy. This is what we call as implantation bleeding during the early few weeks of pregnancy. This is absolutely normal and nothing to be worried of. So how do we know if it is implantation bleeding which is normal or if it's an abnormal bleeding? Anytime during the pregnancy, if a pregnant woman has bleeding, she has to reach out to her gynecologist to make sure that they do a check ultrasound scan to look for the viability of the fetus, which is making sure that the heartbeat is fine and the cervical os, which is the mouth of the uterus, remains closed. When these two parameters are in place, we can reassure the patient and send them back with progesterone supplements and advise them to have a bed rest. They can come back after 1 week or 2 weeks if there is mild spotting on and off. We can do an interval growth scan to see if the interval growth is optimum. For example, earlier the first scan was done at 8 weeks of pregnancy. After 2 weeks, if we repeat a scan, the fetus should be of the size of 10 weeks of gestation. If that is maintained along with fetus heartbeat, then the pregnancy is absolutely normal and nothing to be worried of. If the spotting continues and in the next ultrasound scan, the interval growth is not optimum or if the heartbeat is not there, this could be a potential missed abortion or incomplete abortion. So check ultrasound scan will be the deciding factor along with the symptoms of the mother. What could be the other reason for bleeding? There is something called subchorionic hemorrhage or hematoma, where a small quantity of blood is collected beneath the chorionic villi in the placenta. This could also be a potential cause of bleeding in early weeks of pregnancy. This would again be diagnosed by an ultrasound scan. Once this diagnosis is made, the advice would be optimum bed rest, avoid lifting heavy weights, and to come back for a check ultrasound scan 3 weeks or 4 weeks later. The pregnant women will also be supplemented with progesterone supplements just to make sure that the pregnancy is going well. Now, what could be the pathological causes for bleeding in pregnancy? So, anytime during the early weeks of pregnancy, if a pregnant woman comes with complaints of bleeding or spotting per vagina, we do a check ultrasound scan, and during that scan, if we find that the interval growth is not optimum or if the heartbeat was present earlier, like maybe 7 weeks or 8 weeks, but now along with the complaints of bleeding, if the heartbeat is not there or the cervical os is open and few products of conception is already in midway, this could be miscarriage. In such cases, medical termination of pregnancy is advised to the pregnant women. So if you want to have one takeaway point from this video, that would be anytime during your pregnancy, if you have spotting or bleeding, make sure you visit your gynecologist in person and do a check ultrasound scan to make sure of two things. One, the cervical os, which is the mouth of the uterus, remains closed and the fetus heartbeat is good. If you continue to have spotting or bleeding, then do an interval growth scan after 2 or 3 weeks to see the interval growth of the fetus is maintained. If these parameters are in place, then you need not worry about the spotting or bleeding in your early pregnancy. I hope you found this video useful. Do like, comment and subscribe to my channel and press on that notification bell icon so that you don't miss out on any new videos in the upcoming days in my channel. Do share it with your friends who are worried about bleeding in the early pregnancy, so let them get educated about this as well. Until I meet you in the next video, stay happy, stay mommified.